No freedom from insurance. The Democrats like to cite that the 47 million people in America who don't have insurance is one of their primary reasons for passing the new law. Everyone assumes those 47 million are poor people who can't afford insurance, but over 9 million of those without insurance make over $75,000 per year, and 11 million of the 47 million refuse coverage offered by their employers. Another percentage consists of those who are so wealthy they don't need coverage, and they can pay for their health care needs right out of their pockets. For all those of these millions of people, the government says, too bad. The new law requires them to buy insurance or face stiff fines, $1,000 or more, or prison time. You are now a criminal in this country if you don't pay for insurance. You no longer have the freedom to determine if you want insurance or not, regardless whether you can afford it or not. There's the big misnomer. People think, I'm finally going to get health care. Yeah, at your expense, not somebody else's. No freedom to choose. While the new law still gives you the ability to choose your insurance carrier, and even most of your doctors, according to the plan you purchase, it does remove other freedoms. Judge Andrew P. Napolitano of Fox News gave the following example. In February, Senator Frank Lautenberg, Democrat, New Jersey, collapsed in his apartment in Cliffside Park, New Jersey, a few miles south of the George Washington Bridge. When he called an ambulance and it arrived, he had directed the driver to bring him to Mount Sinai Hospital in New York City. That direction is today perfectly lawful. Under the new law, such a direction would be unlawful, as an ambulance would be forced to take a patient to the hospital closest to the patient. In Senator Lautenberg's case, a small community hospital a few blocks away from his apartment. Senator Lautenberg voted for a law that would deny him the free choice that probably saved his life. Insurers lose their freedom. Insurance companies run their businesses by statistics. They know what it takes to make a profit. One of the least popular policies that has ensured big profits for insurance companies is their exclusion of people with pre-existing conditions. The policy limited people's options for policies, created expensive premiums for those with previously existing health conditions, and prevented people from avoiding insurance only to sign up when their health deteriorated. The new law bans insurers from denying coverage on the basis of pre-existing medical conditions. If you remember, though, many of the insurance companies supported the new law. Why? Doesn't this eliminate a substantial portion of their profits? It would. But remember, the new law doesn't allow people to avoid insurance until their health deteriorates. Everyone must be covered, so the insurance companies are protected for now. The compulsory coverage clause in the new law is one of the most vulnerable to constitutional challenge. Judge Napolitano believes the federal government doesn't have the legal authority to order citizens to buy insurance. The Congress is ordering human beings to purchase something that they might not want, might not need, might not be able to afford. That's never happened in our history before, Napolitano says. My gut tells me that too is unconstitutional, because the Congress doesn't have that kind of power under the Constitution.